everyone. You are listening to another episode of the Colleague Down the Hall podcast. I'm your host, Jeanene Wolfe, and today I'm joined by Erin McCarthy Shaw. Erin is a board-certified psychiatric mental health nurse practitioner specializing in comprehensive neuropsychiatric and educational assessments. She's licensed in New York and Connecticut. Erin has completed extensive postmaster's training and psychological assessment under the guidance of Darlene Sousa of Mindful You Consulting. And I spoke with her in a previous episode 88, if you want to check that out. But we're going to go just a little bit deeper today about getting started and incorporating that into your practice. So welcome, Erin.
Thank you for having me. It's great to be here.
Yes, good to have you. Okay, so we were kind of referred to each other by a mutual friend and then realized that I didn't know that you had done the stuff with Darlene Sousa. And I was so blown away by what she's offering and wanting to do that in my own practice. So I'm super glad that we were put together so that we can have a deeper conversation about actually implementing this stuff.
Absolutely. And the timing was quite perfect because I think you talked to her last month and then, we're talking today. So I absolutely loved the program that Darlene offers. I've done her level 1 certification and now I'm in her level 2 certification. And so we're almost coming up on a year of working together.
So after level 1, were there things you were able to start implementing right away?
Yes, actually, even before level 1. So even before level 1 ended. So I started level 1 in February of 2024.
Okay.
And the focus, mainly ADHD, autism, but I think broader than that, Darlene is really big on, really understanding the differential diagnoses that go into this. So it's not just a check, you meet criteria. Is there anxiety? Is there maybe something else going on? Or are the symptoms better explained by something else? So started that process of, really gaining a much deeper understanding of neurodivergency than I've ever really had before. And I've been in practice for over 10 years at this point. And so even before officially graduating, I had a number of tools to put together an assessment for ADHD and autism. And then the idea behind doing level 2 is that you would, again, do that deeper dive into some of the other areas like IQ testing, so cognition, memory, language and communication, just way more extensive understanding of certain instruments that are used to assess those conditions so that you can really walk away with a truly comprehensive assessment where you're really looking at every single angle in many ways of what may or may not be going on.
All right. So what impact has adding this to your practice had for you?
Yeah, it's been interesting. And I would say that it's still very much a journey. So I really started to launch probably could have done it sooner, but this is just my comfort level, the assessment side of things in July. And at that point, it was focused on ADHD and autism assessments. And it's been great. Most of the people that I've assessed are actually clients that were considering doing this or had questions and then wanted to kind of move forward with a more formal assessment. And they were thrilled to find out I can do it with you. I don't have to go to a new provider. I don't have to tell my story again. I don't have to wait for 6 months to be seen. So in that respect, it was really convenient and it kind of helped streamline services. And really, I think, especially for the existing patients, a couple of them we've been working together for a while, but it really, I understood them better. They understood themselves better and I understood them better. And I think overall it was great for treatment. And then I kind of, over the fall, I've been gradually kind of networking and putting it out there that I am doing this. And it's been great. I think sometimes it's a bit of an adjustment for some people to go, oh, you're a psychiatric nurse practitioner, but you're doing this. And it's different than the psychiatric evaluation you normally get with a psychiatric nurse practitioner or a psychiatrist. But when I explain it to people too, that it's the idea is okay, so it's not only the testing that we're looking at, if it's ADHD, autism, sometimes people just want a neuropsych assessment, but we can also look at lab work. I can review your medications, your medical records, and kind of factor in how is that factoring into your overall presentation? Even the little things like doing a very brief, simple hearing and vision assessments as an NP, you can include that in the overall assessment too, to go like, okay, we have ruled that out too, that it's not a vision problem, it's not a hearing problem, or, like basic ones, and then refer out if needed. So, again, it's been a gradual process of kind of offering these services, but it's been great because the response is typically done like, oh, this, I can see, one person as opposed to going to a whole bunch of different people. Same with streamlining referrals too, is that if somebody is in need of an executive function coach or a tutor or whatever, rather than having to get the evaluation and then figure out where those people are, I have, connected with so many really neat and amazing different providers of different disciplines. So the goal is like, okay, I will help you streamline that too.
Okay. Yeah, that's great. Yeah, and there's such a huge accessibility issue with these types of testings. And so I think having more providers can only be a good thing. But I also know that in some of the therapist spaces, if someone mentions that that's not a psychologist, then they get all defensive and you can't do that. And do you know how many hours it took me to do, blah, 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 blah. Did you experience any of that?
Yeah, I have. Yeah, there seems to be two when I'm coming in as a psych NP. I should preface this by saying I'm kind of used to it. Psychiatric nurse practitioners, we've assumed a lot of the roles that psychiatrists traditionally do. I'm not a psychiatrist, but like we prescribe
And traditionally people. You're also more real people, I think, from some psychiatrists that are out there.
I like to hope so. So we have historically face obstacles when it's kind of thing of like, oh wait, but I've got my doctorate. So I was used to it to an extent, but yeah, there was also kind of two camps of like either those that were kind of curious, like, wait, what are you doing? How are you doing this? What was your training? And then yes, definitely ones that were like, you shouldn't be here. You have no place. And going back to your point, though, yeah, it's access to care. We don't have enough people to do anything in mental health. We don't have enough therapists. We don't have enough prescribers. When I tried to take a step back from prescribing, like I feel like I got more referrals because there's very few people taking patients right now. And so the same is true with assessment. There's simply not enough really talented, skilled practitioners that are doing this. In terms of that scarcity mindset, I think if a person's that worried about, not having enough patients, there's, maybe something else is going on because there's like there's not enough people to treat the number of people that need care right now. So yeah, so there's a bit of that. I think there was also some confusion too. This isn't always with psychologists, but even just mental health practitioners. I noticed a lot of people would, I think Darlene mentioned this too, would be like, okay, the person needs a neuropsych, right? And it's only a neuropsych, nothing else. And there's so many types of evaluations that you can offer people, ranging from a full neuropsych with lots and lots of testing, psychoeducational evals that are focused on ADHD or autism. I mean, it's a range. And so sometimes I notice when trying to get my name out there, I'll be like, okay, this person needs a neuropsych, but I'm not even sure that was necessarily the case. So yeah. It's been interesting. I feel like I'm on the forefront of something very new.
Yeah, I think you are. And I think it's very exciting. And, over the years, my parents would be like, and they tried to pawn me off on a a PA or an NP. And I'm like, they're very well trained. You are in good hands. But, even with the older generation, they just don't understand that. And I think it's still somewhat new, physicians, assistants, and NPs. But I think most people who are exposed to anything in the medical world get it now.
Yes. Exactly. And look, not this is a bigger issue, but like, yeah, not all mental health practitioner programs just in general, whether it's a PA, an LCSW, an LMHC program, like not every program's created equal. And then what people do after they graduate varies. You could go out and get all the experience in the world, or maybe you didn't. But I think there's just so many layers to this. So when we talk about somebody coming out and doing these types of assessments, and yes, it's not the traditional route, but I think with the right training, the right experience, the motivation, it can actually be an incredibly positive thing for patients who are waiting months and years be seen and get the services they need.
Yeah. So I was curious when you said that you're able to do assessments with your own clients, because I recently was talking to a therapist who said their therapist does that testing and their daughter needs a testing, but the therapist is like, no, because I'm treating you, I can't see your daughter. So, I mean, I know in therapy you wouldn't do that unless it was like really specific circumstances.
Oh, are you asking about testing on your own patients, not testing on another family member or?
No, it was, well, she said the therapist couldn't test on her own patient, and she also couldn't test on her patient's daughter. And I was like,
Oh, hmm.
okay. And it
I
might
have
just be
never.
lack of knowledge. Might be lack of knowledge, right?
It might be lack of knowledge. I mean, look, we have to assess our patients, right? Like we assess them when we
Right.
first see them. If something new comes up, we
Mhm.
have to assess that. So,
Right.
so I think and again, it might have been comfort level. Some people, aren't comfortable touching like ADHD or whatever. They
Mhm.
prefer to refer out. And I think in that instance, it's a responsible thing to do, right?
Sure.
But
Yeah.
I think in both of these cases, they were people, especially I'd worked with for a while. There'd been questions about some of these things, and it was like, all right, we're ready. Let's do the deep dive. And it was just kind of a very natural continuation of the care that we'd already been doing. And it felt great too because I knew them.
Yeah.
There were a lot of, yeah, I'd already done a psychiatric evaluation on them. And I really knew them. I knew some instances, their families, the dynamics that were going on. So it was like, it kind of tied everything together in this is the missing piece of the whole long therapeutic assessment process versus it feeling like this separate step in the treatment plan.
Okay. Well, yeah, and I think it does make a lot of sense. Like even when something changes and we need to refer a client out to another therapist, they're like, "Oh my gosh, I have to start all over," and that is a real concern, and it is a real experience as well.
Of course, exactly. And I think it actually feels really good to do these types of assessments on patients that for that reason, because there's so much that happens with, talking to people and the clinical observation and then the testing itself. But then there's this relationship that you form with them, and especially with a long-term client, and that some of that stuff that comes up, like you can't get it in 1 to 2 revisit. So yeah, I've loved doing it. I've worked with non-patients, non-former patients too, and you can still do a deep dive and get a lot of information. But yeah, it was actually a very, I think, positive aspect of treatment.
So, are you finding that you offer this to more clients now than you would have if you were referring out?
Yes. So it's interesting. One of the things I learned, so going back June, July, I'm launching my business. I'm really excited. I have this idea of how it's going to go in terms of marketing. Darlene's giving me tips, but I'm, of course, as many of us do, we do the same thing we've always done to get patients. I'm like, this isn't working as well. And a lot of it too is like, right, but you're a psych MP, or, if I was responding to say an inquiry in like a professional Facebook group, it'd be like, but they need a neuropsych. And I was offering ADHD or autism evaluations at that point. So it really made me kind of rethink how I was even going to put this out there. And so that yeah, that in and of itself was a journey, because I really had to start thinking about like who needs this, who refers, who understands the assessment, and who's going to, refer appropriately. And so I ended up getting connected with a lot of wonderful educational therapists, executive function coaches, tutors. I belong to a really awesome group based out of New York City called Tutoring League NYC. It's a group of educators and educational aligned individuals like myself, and so that really kind of shifted things, where these are folks that are really, they're working with students especially all day, and they're actively looking for people that are doing assessments that kind of align with the educational goals and the school accommodations. And so at this point, I almost think my business is kind of, it's all one, but it's almost like two separate parts. There's the the kind of assessment piece, which is the referrals tend to come from, like I said, educators, tutors, and folks that are really deep in that world. And then there's the mental health piece where I'm still prescribing, and that tends to be very different referral sources like therapists, et cetera.
Mm-hmm.
So
Yeah.
that was, like I said, a big learning curve of like, wait a second, the old methods working is effective.
Yeah. Yeah. Well, I think in general, the old marketing methods aren't working for anybody right now. So
No,
everyone's
no,
having to reevaluate. Yeah.
yeah. Let's just regroup. Let's just redo everything we've been doing forever. But, overall, like a super positive experience, though, because I discovered this entire world of people that we do in many ways the same things. We're working with the same people, and we really kind of need each other because so much of what I do can impact like a student's performance and success, and so much of what they're doing also impacts it. So it was great to kind of collaborate and connect and hear this very different but very similar viewpoints, especially when it comes to teenagers.
Yeah. Yeah. So what ages do you work with?
For my assessment business, I work with elementary age and up. And for my prescribing side of things, it's 13 and up. So quite different. Well, not quite different, but different age ranges. The assessment side of I'll say the 13 and up really came from more or less FDA guidelines around prescribing. And the assessment piece, I shifted it because so many of the folks that need assessments are elementary school age kids.
Yeah.
So I've worked with elementary school kids before. It was just, like I said, in my private practice that I'd focused on 13 and up. But when I got started, I was like, wait a second, there's a huge need here. I do know how to do this. So I should put it out there, and it's great experience too.
Mm-hmm. Yeah, absolutely. Yeah, and in my own private practice, I stopped seeing kids and teens years ago because I just got into so many situations where parents are now divorcing, they want records, or they want me to testify that or write a letter that they're an amazing parent when I've never seen them interact with their child.
Yeah.
And so I had stopped seeing kids and teens for that very reason, but it sounds like with assessments, it's a little bit cleaner. It's like you're doing the assessment.
Yes, it's a little bit cleaner. You still have to watch out for these things. And I did just recently hear a story of a person that like it got messy right from the beginning because of custody issues. And so it was a great cautionary tale. But yeah, you still have to be careful of these things. But yeah, you're not developing in most cases, unless you're working with an existing client, you're not developing this long-term relationship where you're evaluating, ongoing. And this is where great paperwork and great, practice policies come into place because I definitely have a clause in there that I'm not a forensic evaluator, so I can't make some of these calls. But yeah, I have to say, I think I've arranged it so that in most cases that minimizes the kind of demands for paperwork, document, whatever it is outside of scope of practice.
And do you do this in person or online or both?
Yeah. So my medication management practice has historically been telemedicine. I started it during the pandemic, and I'd already been doing telemedicine as most of us had been at that point.
Yeah.
And it just continued. The assessment side of things, I have done it remotely, but this form of assessment, although there's so many elements of it that are similar to the psychiatric evaluation, the testing side of things, I made the decision to do that in person just because it's significantly easier.
Okay.
Even simple things that you take for granted, like just having all of your paperwork in the same place, like not having to go, okay, like the one thing that had happened when I first started out, and again, good learning, I had a person, and about partway through their assessment, there was some question about, is there maybe some like a learning disability in there too? I'd already mailed out the packet to them, so then I had to like remail it. We ended up having to kind of redo a portion of it. And I'm like, it's just simple stuff like that, like little things like that you're like, you know what, it's much easier to do this in person if you have all of your stuff there. Technology, unfortunately, I found out that it can go haywire. There was one assessment I was doing on a person, and I needed to use I created a PDF of some of the images they needed to see, and sure enough, it wouldn't go to the second one when I needed it to. So I was like, yeah,
Right.
it's much easier to do this in person, at least for now. I'm sure there are people doing it remotely and successfully, but I'm not there yet.
Okay.
So
Yeah. Yeah.
yeah. So I did have a school like, yeah, the school was going to have me do an assessment. They were like, no, we have some of the materials here. I'm like, yeah, no. That's so great that you do, but I've had too many issues with remote.
Yeah. 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 You become sort of masters of tech when you do online services. I was helping a client through a tech
Yeah.
issue the other day, and she was like, "Oh my gosh, you're amazing." I was like, "Nope, I just been doing this for a long time, and you learn
Right.
all the glitches at some point, or at least
You
you hope you
do.
do."
You do. And I've actually had a couple of parents complain to me about like electrics. Like, I don't like this electronic health record because of their features. And I'm like, I don't even have anybody to pass this along to. I mean, I guess I can pass it along to support, but it's just me. I'm the IT department. I own this practice and I do the administration and all the clinical work. So I'll just note it. Noted. But yeah, you do become an expert at some things, technology, but man, when it goes
Yeah.
wrong, it can go really wrong.
Yeah. 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 I've had those experiences too.
Yeah. Yeah. And I'm sure there's also too those moments where you're like, I have to keep my composure because the other person that is here, that is paying to be here, is what is supposed to have the anxiety in this moment.
Right. Right.
Oh,
Okay.
yeah.
All right. So, what else can you tell us about just doing this and making a decision and implementing all
Yeah.
that?
Yeah. I will even, I'll just backtrack and kind of tell you about how this even started on this journey. It
Okay.
was about almost exactly a year ago. I think it was in one of those weird lulls that happens in the winter where it's either crazy rush and then a weird lull. And for a while, I had been feeling like I was getting a lot of referrals for ADHD. And well, it's accepted practice to evaluate ADHD via a psychiatric evaluation. I felt like there was something missing, right? And there is. There's a huge component that, for me at least, in my opinion, is missing. And so I'd been thinking about like how can I tease out more out of this existing assessment that I need to do. And then, like I said, winter lull. I happened to be on one of the Facebook groups, professional groups, and Darlene responded to somebody's inquiry about it was like how to stay afloat when there's a lull. And I'm like, interesting. I'm kind of going through that too. And she'd responded that she offered assessments and that she trains master's level and up clinicians on how to do these. So I immediately reached out to her and said, you're the person I've been looking for this whole time.
Yeah.
And she introduced me to her 6-month program. I got started and it was great. I was worried because historically, if it's something that has not totally interested me or been engaging, I can sometimes drift off. But it was just the course material was so exciting. And like I said, it was like the pieces that were missing from all the training that I'd already had and the experiences I'd already had. And so it was, it's a lot of work. It's about 8 to 10 hours a week of studying and projects, homework. She does give some really good homework assignments that just really get you thinking, and it brings you back to when you get this, like when you were back in your training and you had to do sometimes like notes or whatever. You're like, oh gosh, this feels redundant, but it gets you in that mindset of how to construct the documents, how to analyze things. And so I want to say I started that in February and I was done in July. Met some really, in addition to Darlene, some really amazing other practitioners and providers, and have continued those relationships even after leaving level one. And yeah, it was great. We did the weekly coaching calls, which is so wonderful because you get together and you're like, all right, I didn't get this. And it turns out, you're not alone, right? And you talk it through. But, for me, it just felt very natural and wonderful. And like I said, it was a big commitment, but you really get out of it what you put in. So as that was wrapping up, I was like, I really don't want this to end anytime soon. Like, this is wonderful. I want to do more of this. At the time I wasn't, like I said, it was 100% telemedicine, but it really it made me want to go back and see people in person. I loved the writing aspect. I loved really like all the different, to be very analytical. And so like all the different ways of really thinking and conceptualizing and also really you're getting to the nitty gritty of what's going on, and you can create very streamlined and individualized recommendations when you have that information. And so that, so like I said, I started level two. Actually, level two I took a little bit of a break, but level two started in October, and it's been wonderful. I continue to meet with Darlene regularly just to kind of go over cases and go over assessments, to go over even how do you launch this business when you are not a psychologist and you're doing, this isn't something that you do typically. And so I feel like one of the huge benefits of this program, and I haven't ever looked at any of the other programs out there, but one, Darlene is a testing psychologist, and two, you get so much hands-on opportunity to ask questions, learn the material, learn the assessments, learn the theory, really get enough background that you walk away. I mean, it's not perfect. It's like most of us when we graduated, like we have a lot of textbook learning. We haven't had that chance to apply it consistently in practice, but, really walks away feeling much stronger as a clinician, and much even for the people that I'm not assessing, but the folks that have ADHD, really, I think, better able to have an educated discussion with them about what's going on.
Mm-hmm.
So what's going on? What are your symptoms? What is that related to? I think it's not just benefited the assessment folks, but just all my patients in general.
Mm-hmm. Okay. And so I'm sure this is debated all the time in therapist groups, professional groups, private pay or insurance. So are those both options, or does insurance cover this?
So I am a private pay or I guess out of network. Some people don't submit, so I guess they're private pay, but I do provide super bills. It's interesting. I don't have a ton of data on that, but I would say that I wouldn't even have data on that for my med management folks, even the ones I've been seeing for years, because nobody tells me what they're getting back necessarily. With the only, so I haven't heard, I guess to answer your question, I haven't heard that it hasn't been reimbursed. So yeah. And typically there's one person I'm thinking of right now, like I know they would have reached out to me. So and I know they submitted a couple months ago. So my guess is that it is reimbursable. Because even when I was looking at the billing codes too, I think sometimes sometimes the message is like, oh, only a psychologist can use that code or whatever. But if you actually look at the billing, interestingly, like some of them are like, will say it'll say like, this is a physician code, and then it'll list everybody else afterwards. And psychiatrists have zero training in this. So I think sometimes these are, again, it goes back to like, these are things that are traditionally done by a certain discipline.
Right.
But there's no hard and fast rule that they're the only people that can do this.
Right.
But I think we all, and hopefully this will expand more. I know that services and what we all as practitioners can offer will expand more, is what I mean. Because I don't, certainly people that are not qualified, not trained well, not competent should be administering certain assessments or prescribing medication or providing therapy. And that's just true across the board. But I think if we can make things easier for folks, if we think of our patients, the ones that are coming in that have been, struggling for years with symptoms or just who they are, who their identity is, they've developed anxiety and depression. If you tell them, well, you've got to go to this person first, and then I've got this therapist for you, and then I've got a prescriber, they just shut down. And so how can we make this easier for people?
Right. Yes. It's like occasionally a client will be like, yeah, can you also see my husband and I together? I'm like, it's probably going to be 3 therapists that are seeing you, because your husband would probably benefit from therapy as well. And then you need a couple, and then they're like, this is way more than I thought it was going to be. I mean, it's best practice most of the time, but yeah, it's overwhelming from the client side.
It's overwhelming. And exactly. And I think there's some things that are, we have to adhere to for best practice, for reasons of best practice. But when it comes to things like, say you're with a client, you go through, you go through Diane or Darlene's program, and you're with a client and they're like, I think I might have ADHD and I want to go get a formal assessment. You know that client, you know them extremely well. You've maybe worked with them for years. Is it such a bad thing if they get an assessment with you, knowing their history? And no, absolutely not. And it just makes it so much easier for them, if they're working with somebody they're comfortable with, they're showing their authentic self, hopefully,
Yeah.
and they don't have to wait and wait and wait.
Yeah.
Yeah.
Yeah, just you're removing just one more barrier to care. And there's so many in the mental health
So many.
world.
Yeah, there's so many barriers out there. And while many of them have, some of them, I should say, are necessary to an extent, if we can possibly remove some of the unnecessary ones, that would be great.
Yeah, I agree. I agree. I got a phone call once from a dermatologist about prescribing Accutane to a teenager I was seeing. And he just was like, "Can you call me back?" And I called back and I was like, "I can't confirm or deny that I know this client." And he's like, "What?" I was like, "It's a little more strict in mental health. So if I'm a provider, I would need to receive a signed consent form to release this information," and he was like, I think he thought I was just being a jerk, but I'm like, no, this is mental health. This is viewed on a whole different level. Yeah. And not everyone gets that in the medical community.
No. I've worked in previous jobs, a previous job where it was integrated into primary care, and it was really hard to get that point across that it's like,
Yeah.
I know you referred that person and we're both seeing them, but it is separate. And again, there's, I think it's important to an extent to have those safeguards in place, just because mental health is so nuanced in so many ways. And even with documentation, if you're looking at it, what's written is so different than the person that you're seeing in many ways. But yeah, again, going back to that, like there's just so many barriers. There's making the phone call. And, you've probably experienced this before. You give somebody a referral or for somebody like, hey, you really need to see this person. Maybe they'll go and see where they'll reach out. I had a parent contact me the other day because somebody that I discharged months ago, it was agreed upon. They were moving out of state. They needed a refill. And there had been a lack of communication there about, well, yeah, the person was in college and hadn't communicated to the parent that they'd been discharged, and there was this new person they were supposed to see that they never called months ago. So it happened, right? And so, but how does that impact the care we provide, right? Like, so going back to this, like, how can we make it easier for people to get seen? I look at it in my instance of, if I'm no longer taking, at the moment, I'm no longer taking people that wish to be prescribed ADHD medications. But when I was, the question of like, is this, especially with the really, sometimes it's more apparent, but then sometimes again, it's more nuanced, and you're going, well, maybe it's ADHD, maybe it's autism, maybe it's anxiety. It really needs testing. I can't move forward with a plan of care until I have that data. But then you're giving the person the name and, okay, I've got to get this set up. And then just, even if it's not money or, they're on a wait list forever, sometimes it's just the idea of, I've got to go tell this story all over again. Why do I have to do this? And I get that they're probably sick of repeating themselves. Yeah. And so, right. This piece of like, okay, not only can I get you seen sooner, I get the information I need, you get the information you need, and we can move forward with treatment.
Mm-hmm. Yeah. Yeah. And that's what all of us want. We want to help the clients, help them move forward and get them to a place where we can discharge them.
Exactly. And they're in a better place. And I think, the thing I love about assessment, and I like to think that I was doing this before in terms of educating patients and giving them a more grounded understanding about what's going on and why are we prescribing this medication, and why am I recommending that you continue with your therapist and don't switch to once a month, but the assessment piece, again, you're getting into that nitty gritty. You're really helping that person understand the nuances of what is going on with them and what they've been experiencing, and validating their experiences, and really saying like, here you go. Here's a roadmap. So whether, you're again, you're continuing because it's an existing patient, or you are referring out based on the findings, they have this really solid understanding of who they are, what they're experiencing, and what they need to do to be successful.
Mm-hmm. Yeah, absolutely.
Yeah. So it's great. Like I said, I absolutely love it. And I would recommend, even if somebody wanted just a better understanding of ADHD or autism, I would recommend doing that deeper dive. I feel like at least I went to a wonderful NP program. I had amazing teachers. It was over a decade ago, so things have changed, but you this I felt like I didn't nearly get into as much information and understanding of these areas of neurodivergency that are very much tied up into the mental health world, but I think also very misunderstood.
Mm-hmm. Yeah. Yeah. Well, this has been a great conversation. I am even more determined to go through the training now, which is something that I had on my list for 2025. So,
There you go.
yep, absolutely.
I
Yeah.
don't
And
think
I
they
was
ever get
just,
it.
yeah, one of the members of Collaboasis in my consultation groups brought this to me. We both work with neurodivergent clients, and she was telling me about this training. And I was like, oh my God, I got to write that down because that is huge. Like, we need that.
We do. Yeah, we really do. And again, I think there's Darlene touched upon this in her podcast session, but a lot of it comes down to understanding your scope of practice.
Yeah.
Really understanding your state scope of practice and regulations, and then from there, it really comes down to scope of competence. Are you okay? So you're allowed to do this, but do you have the training and the education? And I think
Sure.
I would recommend Darlene's program to anyone, but certainly I think it's important for all of us as mental health providers, even if you don't do a formal program, is to just get a better understanding of neuroaffirming care, because it's a hot topic, I know, in our field, but I think a very necessary one.
I agree. Absolutely. Yeah. And there's still too many providers out there who have very outdated ideas of what ADHD and autism are. And so it's like I have to be really careful about who I refer clients to for anything around those things, because true harm can be done to clients when they're told, like, well, you have a college degree. There's no way you have ADHD, things like that just
Right.
put them off. Yeah.
Right. And it's shocking. I mean, that and autism is the other one. Yes, lay people to this, but the number of providers that I've encountered who have what can only be described as a stereotypical understanding what autism is. And we really just need more information. There's just so many people out there that really don't that are at this place where they're like, I've had anxiety and depression, but it feels like there's something missing from my understanding of myself. And like, those are the people that really need these answers and the clarification.
Yeah.
And so we kind of have to, do our due diligence and get the right training. So again, even if we're not comfortable diagnosing it, we can at least be compassionate and not dismissive and open and, accepting of what people believe might be going on.
Yeah. Yeah. Okay. All right. So I always ask this at the end. Erin, do you have a favorite catchphrase or analogy that you like to use?
Yeah, there's one I've been using recently in describing why I think assessment is important, an important thing for people to pursue if they're on the fence. I also think it's helped me to understand why it's important. I say understand why it's important. I will just, the disclaimer, it's a price adjustment from being med management and doing psych eval to doing more comprehensive assessments. So I've had to kind of wrap around my head around that change. But what I've, in any other field of medicine, like if you fell on the ice and hurt yourself, you thought, did I break my leg? Did I sprain my leg? You wouldn't go and just tell your doctor that, and then they would put you in a cast, or your NP or your PA. They would do x-rays. If you hit your head, you get a CT scan. They do a physical assessment. So I think it's for this, that aligns with kind of what we're doing, right? And in that, like, we wouldn't give a diagnosis unless we've really thoroughly investigated, is that what's going on? What are the differentials? And well, you can never be 100% certain, like you have a healthy amount of certainty. So of what's going on. So I have been using that to kind of explain why, like, it's actually important to investigate these things. It seems like a long process. It's a lot of time. It's a lot of money. But in the long run, isn't it better to know what's going on and having a clear, concrete plan that's really tailored to your needs? Or would you rather, if you're really not sure, keep going and getting medications that aren't working for you,
Yeah.
trying all the different therapies out there? It's not that these things might not work or provide some benefit, but it's kind of like throwing spaghetti at a ball and seeing what sticks versus, like, let's actually have a formal plan to understand what's going on. So while these types of assessments aren't necessary for every single person, I think when somebody's considering like ADHD, autism, maybe something else entirely, a learning disability, it's an important and I think wonderful long-term investment that will probably save time and money down the road.
Yeah. Yeah. I agree. That's great. And that is a great way to explain that because there's so many opinions about that as well. So it's a good way of sort of making that more accessible to someone's understanding. Yeah. Yeah. Well, thank you so much for joining me today, Erin. I'm going to put the information you shared with your contact information in the show notes so people can find you if they need to reach out to you. For all of you hardworking therapists out there, please remember our work is hard, but it doesn't have to be lonely.